When the person goes in the high altitude, the partial pressure of oxygen decreased. That affects the human body. Suppose here the human, it is in the high altitude. When it is in the high altitude, partial pressure of oxygen decreased. That affects the lungs. The normal partial pressure in the lungs 104 millimeter of mercury. But in the high altitude it decreased and approximately slows down 64 millimeter of mercury. When it slows down, it can increase the frequency. When frequency increased, it means action potential increased. Due to the higher level of action potential, hyperventilation. Hyperventilation affects the breathing rate. Hyperventilation increased, the level of breathe in the human body also increased. Breathing rate increased. Now, remember, when there is low level of partial pressure into the lungs, it is so dangerous. It is extremely dangerous because it can affect the alveoli. Look at, when it affects the oxygen comes, affects the alveoli. When it affects the alveoli due to low amount of oxygen, the vessel of the lungs constrict. When constriction of the vessel, pulmonary edema happens. Sometimes due to low partial pressure of oxygen, it affects the brain. In the brain, cerebral arteries, these arteries have blood flow. In the high altitude, vasodilation in the arteries, in the cerebral arteries increased. When vasodilation in the cerebral arteries increased, it means more space in the vessels, more fluid, more space, it means more fluid. When more fluid in the vessel, guys, it means intracranial pressure of the brain increased. Now, cerebral edema happens. Due to increased intracranial pressure, herniation in the brains